Senator Edler, would you yield for a question?
Senator Edler, would you yield?
Sure.
Thank you.
Senator Bennett, you are in order.
Thank you. I apologize, and I appreciate that. Senator Edler, earlier you spoke about public health, and I agree with you that public health for our youth is important. So let's talk about public health as it relates to this bill. Could you tell me what the leading cause of death for kids under 19 is?
I'm not sure how that is relative to the content of this bill, Senator.
Okay, it's relevant to this bill because we are talking about public health. We are talking about health care for children. And it's been established that there's a suicide risk with transgender kids that this bill directly impacts.
This bill is about the prohibition of experimental procedures on Iowa children.
Okay. Thank you very much. So I understand it. It sounds like not too much information. You probably don't know what the second most prevalent cause of death is either for people under 19. It's suicide. I was wondering, we lost you here. Could I ask you a few other questions?
Senator Edler, would you continue to yield?
Sure.
Thank you. I appreciate that.
Senator Bennett, you are in order.
Thank you very much, Madam President. So, Senator Edler, as you were putting this bill together, were you aware that 82% of trans people have suicidal thoughts and that 40% have attempted suicide?
That is quoted in a short-term study. What I'm concerned about is the long-term effects in which individuals who have had transitioning procedures are 19 times more likely to commit suicide than their cohort of control.
Would you consider committing suicide prior to transitioning to be a long-term effect? That's okay. You don't have to answer it. Just one other point of clarity. Are you aware of the medical organizations who support and define best practices for trans youth, like the American Medical Association, American Academy of Pediatrics, the Endocrine Society, the American Psychiatric Association, etc.? Were you aware that gender-affirming care reduces suicidal thoughts in trans kids by 73%?
I am aware that those studies are 12-month studies, and they are not the full picture of what is going on with these repeated experimental, non-FDA approved procedures that we're trying to regulate in the state of Iowa to protect kids.
I see. So this bill particularly applies to transgender kids. We've gone over the fact that every single major medical organization acknowledges the risk of suicide among these kids and acknowledges that this treatment is something that can keep these kids alive. Are you aware of any other laws denying recommended care to a particular group of people?
Senator, what I am aware of is that using puberty blockers can make your bones weaker. They can cause other brain development issues. They can cause strokes. They can cause heart problems. These are why we're publicly regulating these bills, or these procedures, excuse me.
Okay, I understand that. And are you yourself a doctor? Okay, that's okay. You don't have to answer that. So you weren't able to answer the question. I'm not aware of any other laws that deny recommended care by major medical organizations to a particular group of people who are at an especial risk of death. Only transgender people have laws being made about their care which impact their ability to live on this planet. Just trans people.